Well, good morning.
Good morning.
I'm Joe DiVirgilio, Chairman of the Sarasota County Public Hospital Board, and it's my honor and privilege to welcome you to an important milestone in Sarasota Memorial Healthcare System and our community. Welcome to everyone. The groundbreaking of our new Oncology Tower, the heart of Sarasota Memorial's evolving Cancer Institute. On this very site, we are building a center of excellence that brings together the best doctors, the latest research, the most advanced treatments, and a lifetime of support and follow-up care for cancer patients in our community that is not in one place but will be in the future. Whether it's genetic testing to help people learn about their risk factors, advanced imaging to detect cancer at its earliest stages, the precision and accuracy achieved by robotic surgery tools, access to clinical trials, or compassionate navigators to guide patients through their cancer journey. Sarasota Memorial will be that source of top quality and what I've coined world-class medicine right here in our community. I'd like to recognize my colleagues on the Sarasota County Public Hospital Board. If I could just ask the front row here to stand and be recognized. This group, along with the visionaries and leadership of this hospital, the exceptional physicians and the SMH team members, are here today. My script says please stand, but I believe they are all standing in the back. So how about a round of applause for those visionaries? None of this would be possible without their vision, the board's vision, their dedication and leadership. The board and our community thank all of you for taking this step forward to bring world-class cancer care to our community. Thank you. At this time, I'd like to welcome Sarasota Memorial CEO David Berenger, who has led this and a multitude of transformative changes for our healthcare system and for our community. David?
Good morning.
Good morning.
So thanks, Joe. We wouldn't be here without the help of our hospital board, steadfast support and commitment to provide the community with the highest level of care. So on behalf of me and the administration here in the community, thank you all for your service. Today's groundbreaking is the latest step in our journey to ensure that all oncology patients have access to the latest and most effective care in a state-of-the-art facilities located right here in our community. About 5 years ago, Dr. Rick Brown, Dr. Jim Fiorica, and I sat down to discuss establishing a comprehensive cancer institute. We didn't really know what we were getting into at the time, right, Rick?
Right. We're in it.
We're in it. We all knew that Sarasota Memorial had been providing excellent cancer care for decades. We have had an outstanding team of physicians, specialists, clinicians, nurses, support staff, and community partners. But with the growth of our community and the increase in cancer cases, it was time to expand our oncology program and develop a world-class cancer center in our own backyard. We recognized that we could truly have a truly exceptional program if we could provide premier facilities that offer coordinated, collaborative care across a full continuum, with a healing environment that supports the most advanced and individualized diagnostic treatments and testing, and most importantly, the best possible patient experience. So our team of incredible physicians, which unfortunately are way too many to stand here and name all today, came together with our staff and partners to make this vision a reality. And they have done an outstanding job of planning and developing a patient-centered cancer institute that will set a new standard for leading-edge care. A key component in establishing the program is building upon our existing medical expertise. And over the past few years, as we have been out recruiting new physicians to our community, I've promised them a new world-class oncology facility that would accommodate the innovations in future. So Dr. Meredith, Dr. Chomiak, I've kept my promise to you. At least we dug a hole today, all right? In fact, our oncology tower, which will open in 2021, is a centerpiece of several new state-of-the-art facilities dedicated to cancer care. Earlier this year, many of you attended our groundbreaking ceremony for our innovative and new radiation oncology center on University Parkway. We also have begun planning a third phase of our Cancer Institute, an outpatient oncology pavilion that will be located right here on our main campus. Right over there, all right? You hear that, Rick?
I heard it, David.
Okay. Our goal with these facilities is to address each aspect of life that cancer touches. With the greatest expertise, compassion, and support, we appreciate the guidance and leadership of all of our physician partners involved with the Institute. We would not be here today without you. There are also dozens of dedicated staff members and partners who have devoted countless hours to enhancing cancer care. Many are here today, and while time doesn't allow me to mention all these amazing individuals, I'm going to take a moment to recognize several leaders of the team that's doing an outstanding job of managing the planning and construction of the new tower. First and foremost, our Chief Operating Officer, Lori Lang, who has been guiding the development. Lori, where are you? She's been guiding the development of the Oncology Tower, but several other facilities that also make up the Cancer Institute. Our Cancer Institute Director, Kelly Batista. Our Patient Care Director, Yolanda Green. Yolanda, where are you? Our Associate Chief Nursing Officer, David Patterson, who is helping to oversee the design of, go ahead, clap. Go in the back. He's helping oversee the design of 9 new operating rooms in the tower, which is the largest expansion of our ORs we've ever had. And of course, our Director of Architecture and Construction, Tom Perigo, and his design team of Flat Architects in Brassfield, Glory. You and our entire team have played and will continue to play a vital role in transforming the way cancer care is delivered to the community. I'm pleased to also recognize some of our city leaders that are here with us. We always appreciate their leadership and support. We have our Vice Mayor, Jen Ahern-Koch. City Commissioners, Willie Shaw. And Hayden Brody, I think is here. Maybe. I will tell you before I go on, Willie, our Commissioner Shaw, last time I stood up in front of you and told you we were going to build something, we did it over in Newtown. I think you were okay with that, right?
Very much.
All right. We appreciate your support and help on everything. And our City Manager, Tom Barwin. Tom, are you here? Okay. Well, we appreciate Tom's assistance and everything as well. So in a minute, I'm going to turn the podium over to Lori Lang, but first I'd like to recognize our philanthropic partners, Mason Ayers from the Sarasota Memorial Healthcare Foundation. Where are you, Mason? There. And Foundation Board of Trustees and several donors who are joining us today. We are continually inspired and humbled by your generosity that we see from you every day. So now I'd like to invite Lori Lang to come up here and tell you what's really going on. So, Lori.
Isn't it a glorious morning? Thank you, David. And thank you all for joining us. We are celebrating more than a groundbreaking today. We are breaking new ground in the fight against cancer. Because sadly, we recognize that cancer is not going away. More than 1.7 million new cancer cases are expected to be diagnosed this year in the United States, and another 1.7 million more in 2020, and those statistics will be repeated year after year. According to the American Cancer Society, 1 in every 3 men and 1 in every 3 women will develop cancer in their lifetime. And as our population grows and as we grow older, the impact on our community is and will continue to be significant. With our large retiree population, Florida tops the nation in cancer cases. We are second only to California. But there is actually some good news. Many cancers are being detected at earlier, more treatable stages, and survival rates are increasing as well. That's the impetus driving Sarasota Memorial's vision to create a cancer institute, ensuring our community has access to the full range of specialist treatments and technologies to treat and beat cancer. But we won't stop there. Our goal is to offer all of these services in the caring and compassionate way that is unique to SMH. In January, we broke ground on a new radiation oncology center at Sarasota Memorial's University Parkways campus. That outpatient center will open in August of 2020. We are proud that our facility will offer the most advanced radiation therapy available through 2 linear accelerators. This advanced technology will target and treat patients' individual cancer, giving patients the best possible odds. Today, we are thrilled to share our progress on our new oncology and surgical tower. When it opens in 2021, this tower will offer a healing, patient-centered place for cancer patients who are in need of surgical intervention or an inpatient stay. The 8-story tower will have 9 brand spanking new beautiful ORs, including robotic surgery suites. The 2 upper floors will be home to 56 private suites dedicated for hospitalized cancer patients. On the other floors, we will offer an array of services that will include navigation, counseling, and other support services for those that are fighting the fight against cancer. The tower will have its own entrance and reception area, but will connect to the main hospital on multiple levels, ensuring critical 24/7 access to Sarasota Memorial's comprehensive range of diagnostic, medical, and emergency care services. I promise you, this will be an amazing facility because it's been designed with painstaking detail and input from our staff, our patients, and our physicians. Each of us have been touched by cancer in one way or another, and therefore we share a passion and commitment for this to be perfect. If you have been involved in the planning or design of this facility, will you stand or just wave so we can recognize you? A special thanks also to our physicians who have dedicated their time and talent to the Oncology Leadership Group, because we know care goes well beyond the bricks and mortar. And finally, a tremendous thanks to our neighborhood and patient advisory groups, many of whom have shared insight from their own personal cancer journeys. I'd like to ask those of you here to please stand so we can recognize you. Wave. Your empathy and input have been tremendously valuable. You provided feedback on room lighting, other design features, and services that will make recovery from surgery easier. There are so many special touches that you have shared that will inspire hope and promote healing. Thank you for allowing me to share my excitement and pride in this amazing project. Now I'd like to introduce Dr. Richard Brown. Not only is he a beloved medical oncologist, I'm so proud he is our partner and our medical director of Sarasota Memorial's Cancer Institute. Dr. Brown.
Thank you. Okay, long time coming. Thank you, Lori, and thank you all for joining us here today. Wow, isn't this great?
Yes.
I really didn't think that I would get emotional, but I am. I'm truly honored to be here today on this groundbreaking change in the way we deliver cancer treatment and care in this community. These are exciting times in oncology. But as Lori stated, unfortunately, cancer is not going away, at least for now. Cancer cases in our community are on the rise due to the aging population and just because we're getting bigger. We need to do better. The good news is that cancer mortality, as Lori said, is going down. More people are being cured of cancer and more people are surviving with cancer. We have done our homework. We have far more homework to do. We owe this progress to a significant investment in research. We are beginning to understand the molecular basis for cancer. This has led us to new and powerful therapeutics. We have made great advancements in techniques and technology that we are employing to the benefit of our patients. And we recognize that the best way of controlling cancer is either to prevent it or catch it in its earliest stages. We know that cancer is not one disease, it is many. And that every human being is unique and different and comes with their own set of priorities. We recognize that the best way of treating patients is to evaluate and treat the person who's sitting right in front of you. That is our aim, to treat that individual sitting in front of them. This approach to cancer care comes with significant difficulties and is very complex. Proper management takes a tremendous degree of coordination and collaboration among a multitude of subspecialties and disciplines. In other words, it takes a team. We are extremely fortunate in this town to have expert physicians, nurses, and allied healthcare personnel, but unfortunately, our care delivery system is spread out over space and time, leaving our patients challenged to navigate through their illness. Many of you have heard me use the analogy that our care is like a jigsaw puzzle. That what we need to do is put the pieces together and make it one easy process. Today, we put shovel to earth to build the physical structure that we will live in. And we're assembling the specific cancer teams that are working to ensure greater coordination and integration that focuses on best practice, the latest research, and evidence-based treatment protocols. As an oncologist, I see every day the impact that cancer has on my patients and their family and friends. Unfortunately, I'm sure everyone in this audience has witnessed that as well. Today is a great day. Today we lay the foundation to ease the burden, to offer them the best treatment possible, and to provide hope. Thank you. And now we introduce Kelly Batista, the Director of Cancer.
Thank you, Dr. Brown. And I just want to start actually with saying that I feel fortunate to work alongside you to bring this vision to reality. And similarly, I'm going to try not to get emotional as I read through this. But I also want to say thank you to our great physicians and oncologists, many of who I see standing here with us today, and our research leaders for the growing number of cancer patients in our community. The care you provide is exceptional. Today and over the next few years, we are building hope by building a comprehensive, patient-centered, and high-quality cancer program. Because the Cancer Institute is more than just bricks and mortar. We will have a beautiful facility, but what matters most of all is what we do inside of it. As Lori and Dr. Brown both presented, the number of cancer patients in our community is growing. They are our mothers and fathers, our sons and daughters, and our friends and our neighbors. And they deserve a Cancer Institute that meets all of their needs, not only by providing exceptional state-of-the-art treatments, but also by caring for them as a whole person. To help patients and their families through their cancer journey, we are establishing an oncology patient navigation program, which provides guidance and support for patients and their families from diagnosis through survivorship. Our oncology trained and certified nurse navigators are a helping hand, a listening ear, and an invaluable part of our patient-centered design. We are also proud to have established an integrative oncology program. Thrive offers over 25 classes a week, promoting wellness through exercise, education, networking, and support. The Thrive program goes beyond the clinical care for a more holistic approach. Above all, to take the best care of cancer patients, we know that we need the best physicians. We also need the best staff and the best nurses. So I'd like to thank our cancer care team and our oncology nurses, especially Tamala Fonseca, manager of our oncology inpatient unit and infusion center, as well as Kelly Dancer, our administrative fellow, for both of your everyday support and guidance through this process. Our team in oncology is what sets our Cancer Institute apart. We are investing $220 million in these first two phases, the Radiation Oncology Center and this oncology tower. And we are in the preliminary planning stages for the third phase, which will be started after the tower is complete in 2021. By breaking ground on this tower today, we are also breaking ground on a promise of the development of a program that provides comprehensive cancer care, transforming our community, and that is the Sarasota Memorial Cancer Institute. I'd like to take this time to welcome Mason to the stage and thank the Sarasota Memorial Healthcare Foundation, our board, our donors, and our community for your unwavering support. Thank you.
Thank you, Kelly, for that introduction. Good morning, everyone. It is such an honor to be with you today and to share in this historic groundbreaking for the Sarasota Memorial Cancer Institute. I'd like to begin with a thank you to David and the rest of the SMH team for their great partnership. The Healthcare Foundation is lucky to be able to work with such a smart and dedicated group at the hospital. I would also be remiss if I didn't mention how much we have appreciated the time that David, Lori, Dr. Brown, Dr. Fiorica, Kelly Batista has given everyone at the Healthcare Foundation. With your guidance and patience, our team has been able to help bring the Cancer Institute vision to life in our community. So thank you. I would also like to recognize our Board of Trustees, including many who are here today. I want to express my gratitude to each of you for your leadership and vision, both for the organization and me personally. Can I get you to stand? The Sarasota Memorial Cancer Institute. Today, the vision starts to become a reality. We are going to have a comprehensive cancer institute right here in Sarasota. And there is no doubt that the Cancer Institute will have a positive impact on our community for years to come. The Sarasota Memorial Healthcare Foundation is proud to be part of this project. We are the philanthropic partner of the healthcare system, where our mission is to help SMH continue to provide all of us with the best health care today and into the future. But the Healthcare Foundation is much more than just a pretty logo. The Healthcare Foundation is truly about people. We are comprised of and supported by an inspiring group of like-minded people who think not just about themselves, but how they can be of service to others, knowing that the health of our community is what makes it thrive. They are the people we turn to when David and Lori and the rest of the SMH leadership team have a vision like the Cancer Institute and believe that their support can help the hospital exceed goals and maintain that all-important margin of excellence that sets this healthcare system apart, both locally and nationally. Well, over the past year, we have been out sharing that vision with many of those people. We have made the case that no one should have to leave home to receive exceptional cancer care. And, as we foundation people do, we asked them to help make this vision a reality. And they are. So I'd like to take a moment and thank some of our very generous community members who are here today. There are several who have already made leadership level gifts to the Cancer Institute to help ensure the highest level of comprehensive cancer care will be here in Sarasota. Susan Millman, thank you very much, Susan, for your support. Betsy Kane Hartnett, on behalf of the Kane family. Betsy, thank you so much for your support. I really appreciate it. I would also like to recognize Bill Chapman, Bob and Beverly Bartner. Your leadership has been outstanding and invaluable to this project. Thank you. But there are many others who are with us today who have also stepped forward to make this bold vision of transforming cancer care a reality. Please join me in recognizing their support. You know, because of you, SMH remains one of the best healthcare systems in the country. Because of you, we know that philanthropy can make a difference. Today, it's helping bring hope home for everyone who is or will be impacted by cancer. Thank you very much. I'd like to bring David to stand.
All right, so once again, I want to thank everyone for being here today, taking time to come out and celebrate with us, to look towards the future of what we have. We're going to take some pictures, some celebratory pictures here with many different groups. I hope anyone who would like to participate in that, please just come on over. All right. Thanks again. And where are we going next? Point in that direction. That one, right over there. All right. Thank you, everybody.